Hi, my name is Amber Terhune. I'm the health educator for the Johnson County Health Department. This presentation is about cancer. Cancer is a group of diseases with abnormal cell growth. The old cells do not die like normal. They divide uncontrollably, invade other tissues, and they can spread throughout the body through the bloodstream or through the lymph system, known as metastasis. There are more than 100 kinds of cancer, and it can happen anywhere in the body. Cancer is named for where it originates in the body. Most cancers form a lump called a tumor. If the lump isn't cancer, it is called benign, but if it is cancer, it is called malignant. Some cancer cells can hide from the immune system. The immune system usually removes the dead, damaged, or abnormal cells. Here are some of the more common types of cancer. Lung cancer is the leading cancer death, and 80 to 90% is caused by cigarette smoking and secondhand smoke exposure. Skin cancer is the most common cancer in the United States, and it is most often from exposure to ultraviolet rays from the sun and tanning beds. There's also cervical, breast, prostate, colorectal, lymphoma, which affects the T and B white blood cells in the immune system, and leukemia, which affects the blood-forming bone marrow tissue. According to the American Cancer Society, about 1/3 of all people in the United States will develop cancer during their lifetimes. There are more than 1.5 million new cases each year, and more than 7,300 non-smokers die each year of lung cancer due to secondhand smoke. Based on U.S. data from 2012 to 2014, the lifetime risk for all invasive types of cancer for men developing is about 39%, and men dying is about 22%. For women developing cancer, it's about 37%, and women dying from it is about 18%. We don't know for sure what causes all cases of cancer, but it is important to know that it is no one's fault. A small percentage is hereditary, as it may be linked to genes and family history. Tobacco smoke has at least 70 known carcinogens, or cancer-causing chemicals. It causes cancer of the lung, mouth and throat, esophagus, stomach, colon, rectum, liver, pancreas, larynx, trachea, bronchus, kidney and renal pelvis, urinary bladder, cervix, and acute myeloid leukemia. Alcohol increases the risk for mouth and throat, larynx, esophagus, colon and rectum, liver, and breast cancers. Ultraviolet light exposure causes skin cancer. Being overweight or having obesity increases the risk for uterine, breast and postmenopausal women, and colorectal cancers. Being hepatitis B or C positive can cause liver cancer. Human papillomavirus, or HPV, causes most cervical cancers, as well as cancers of the vagina, vulva, penis, anus, rectum, and the oropharynx. Radiation exposure, which can be caused by treating one cancer, may lead to cancer of another years later. It is a small risk with routine procedures. Chemical exposures, as well as air pollution, can also lead to cancer. Hormones, such as long-term or high-level estrogen and progesterone exposure, can increase breast cancer risk. Having diabetes may somewhat increase the risk for liver, lung, oral, pancreatic, ovarian, and breast cancers. Immunosuppression makes it harder to fight infections and destroy cancer cells. Cancer symptoms depend on the location, size, and effect on the body, as tumors can press on nearby organs, blood vessels, and nerves. Someone may not have any symptoms until the tumor is large. Symptoms are often nonspecific that may be related to something else, but symptoms should not be ignored when they do not go away or they get worse. Some of the more common symptoms include fever, unexplained night sweats, fatigue, unexplained weight gain or loss, pain, cough or hoarseness, lump or thickening of tissue, breast changes such as the size or shape of the breast or nipple and the texture of skin, skin changes such as darker yellowish reddened colors, changes in moles or itching, change in bowel or bladder habits and function, sores that do not heal, white patches in the mouth or on the tongue, unusual bleeding or discharge in the mouth, rectum, nipple, or vagina, and trouble eating, including swallowing, discomfort, and change in appetite. Some cancers have recommended routine screenings to check before someone has any symptoms. If precancerous lesions are found, they may be treated before they become cancerous. These screenings may have false positive or false negative results. To screen for cervical cancer risk, a Pap test or HPV test with Pap screen may be done. To screen for colorectal cancer, a colonoscopy, sigmoidoscopy, or high-sensitivity fecal occult blood test may be done. To screen for breast cancer, a mammogram may be done. And to screen for lung cancer, a low-dose CT scan may be done for those individuals identified as very high risk. This means a history of heavy smoking within the previous 15 years and ages 55 to 80. There are some known ways to prevent some cancers as well. A vaccine may be given for human papillomavirus. It helps prevent most cervical cancers, as well as cancers of the vagina, vulva, anus, rectum, penis, and oropharynx. It is given to females ages 9 through 26 and males ages 9 through 21. A vaccine for hepatitis B may be given to help lower liver cancer risk. This vaccine is given starting at birth. A way to prevent skin cancer is to protect your skin. Limit your time in the sun, especially from 10 a.m. to 4 p.m. Wear sunscreen with at least SPF 30. Wear hats, shirts, and sunglasses, and avoid tanning beds and sun lamps. Some ways to avoid other cancers are limiting your alcohol intake. In general, men should have no more than 2 drinks per day, and women should have no more than 1 drink per day. You should also avoid tobacco and maintain a healthy diet, healthy weight, and healthy activity. Consume fruits, vegetables, and whole grains, and limit your red and processed meats. There are different methods that may be used to test for cancer. A physical exam may be performed, including a medical history. Lab tests, including blood, urine, and tissue samples, may be obtained. Imaging tests, including X-rays, CT scans, MRIs, nuclear scans, and ultrasounds may be done to look for abnormalities in structure or function. Biopsy may be performed as well. With a biopsy, a piece of the lump is removed and a pathologist examines it under a microscope. They may also biopsy the surrounding lymph nodes to look for any metastasis. Staging tells the location, size, and spread of cancer. Cancer is then referred to by the stage at which it was at diagnosis. The TNM system is the most common staging system. T stands for size and extent of tumor, N stands for number of nearby lymph nodes affected, and M stands for metastasis. Lower the number, the less size, extent, or spread. It is then easier to treat and there is a better outlook. They may also stage a cancer from 0 to 4, which is from none to present to the spread. Category descriptions include in situ, in which abnormal cells are there, but they have not spread. Localized is where cancer is at the place of origin with no spread. With regional, the cancer has spread to nearby tissue. Distant is where cancer has spread further in the body, and with unknown, there is not enough information. With cancer, early treatment is likely to work best. The type of treatment is dependent upon the type, stage, and spread of the cancer, as well as the general health of the person. Multiple treatment types may be combined for optimal benefit. Treatment may be done to eliminate, shrink, or control the growth of cancer or to relieve symptoms. Treatment can lead to side effects of its own as well. With surgery, the tumor is removed. They may also have to remove the surrounding tissue, which may be part or all of the body part, such as the breast. Side effects include pain, infection, bleeding, damage to other tissues, and anesthesia reactions. With chemotherapy, the cancer cells may be killed or slowed with chemicals. They may also damage healthy cells. Chemotherapy may be oral, IV, or topical. Side effects include nausea, vomiting, fatigue, loss of appetite, mouth sores, and hair loss. It can also lead to a higher risk of infection, bleeding or bruising, and anemia. Radiation is done to kill or slow the cancer cells with X-rays. This may also damage healthy cells. It may be done externally or internally through an implant. Side effects include nausea, vomiting, fatigue, skin irritation, and hair loss. You may be radioactive and may need to isolate during that time. Targeted therapy uses drugs to target changes in cancer cells. It can kill or slow cancer cells. Side effects include diarrhea, high blood pressure, problems with blood clotting, fatigue, mouth sores, and skin problems. Stem cell transplant and bone marrow transplant may also be done for treatment. prognosis depends on the type and stage of cancer, as well as the traits, age, and general health of the person, and treatment response. More people are surviving and living longer post-treatment, but death is a possibility with or without treatment, although death is more likely without treatment or by delaying treatment. As you can see on the graph, the 5-year relative survival rate in 2013 was 66%. Remission is possible. This is where cancer is responding to treatment or it's under control. The cancer may return, but may go into remission again. The longer a person is cancer-free, the better the chance they will stay that way. Complete remission is where the signs are gone and the cancer cells are not detected. Partial remission is where the cancer shrinks but does not disappear. After a cancer diagnosis, you will need to find a new normal. Life may not return to how it was before the diagnosis. There may be new roles and responsibilities for everyone. Be sure to find and do things that make you happy. Stay active and find hobbies. You may go to nutrition therapy to prevent malnutrition and to reduce side effects. It is important to go to support groups or to see a counselor, for the person diagnosed as well as for their loved ones and caregivers. Be sure to talk with friends and loved ones to discuss your feelings, emotions, which are likely to change by the day. Get physical, emotional, and financial help when needed. Be sure to go to routine physician follow-ups to continue to monitor for signs of cancer return or for late side effects. Talk to your doctor about any side effects, stress, and emotions that you are feeling. This concludes the cancer presentation. If you have any questions or concerns, please follow up with your doctor. Thank you.